Hi, Dr. Rao.
Hi,
Good.
how are you doing today?
I'm good. Why don't you start by telling us what kind of doctor you are?
Sure. So I'm a urologist with a group out of Northwest Indiana. We have a total of 9 doctors in our group, focus on general urology, including prostate cancer and a variety of other cancers, as well as kidney stones, and essentially anything that one of our patients comes in with, I'm going to try to help them to the best of my ability.
Well, so you probably have a lot of newly diagnosed guys who just found out they have prostate cancer, either from your own practice or somebody else's. Is that right?
That's right. So prostate cancer is a very big part of my practice. I see patients for this practically every day that I'm in the office, and I'm dealing with this sort of disease for years now. So it is the most common urologic cancer that we're going to see by far. And as you may or may not know, it's the most common non-skin cancer that you'll find in men across the country.
Yeah. And how easy it is that we forget that skin really does have, it's not just a pimple or a weird little bump. I mean, it's a cancer of one of the largest organ of our body, the skin. But so a guy will present with a Gleason score, and he'll give you a history, and included in that would be PSA, maybe free PSA. If he did an MRI fusion, you might get this for that, or information around that, or report. What else? And we're talking about genetic testing today. So,
Sure.
What is the advantage of doing yet something else before you start discussing what treatment options there may or may not be?
Sure. So, with prostate cancer genetic testing, what we're trying to look at is, are there any DNA mutations that exist within the patient that affects their entire body? And looking at those mutations, you can sometimes come across sort of targets for prostate cancer treatments. Currently, there's 2 different drugs that are out called PARP inhibitors that sort of target patients that have prostate cancer, which is already spread. But the goal of these treatments is to sort of beat the current targeted prostate cancer drug treatments that already exist. Now, when you find a patient who has newly diagnosed prostate cancer, as you already alluded to, you're looking at things such as Gleason score, PSA, how did the prostate feel on exam? And it's a difficult conversation for any man to have. I think the first thing that affects patients in general is the idea that I have cancer, right? I think the moment you are talking face to face with one of your patients and you're telling them about the prostate cancer they have, it's difficult to sort of focus on the idea that there's cancer within my body and I need to listen, I need to focus on how we're going to beat it. So I think the most important part of this conversation is to make sure the person you're speaking with understands the aggressiveness of the disease they have, the treatment options which may exist, the opportunity to monitor the prostate cancer. And sometimes that can take people multiple visits, a lot of time to sort of process. So I always encourage my patients to bring a loved one or a friend with them to the visit, just so that we can have more than one person focusing on the conversation at hand. Now, after we have a plan for how we're going to treat the prostate cancer that exists, I like to sort of mention, either at that first visit where we're talking about prostate cancer or at a subsequent visit down the road, about the opportunity to genetic testing for prostate cancer. Now, why would somebody want to do additional testing was a question you asked. And the reason is there's multiple. First of all, we may be able to find targets for prostate cancer treatments that are new and innovative, that are coming on the market as we speak. Secondly, patients who do have genetic mutations for prostate cancer are also potential carriers for other types of cancer. And those cancers may be discovered at an earlier stage if they end up having a mutation present. So helping that person deal with other problems they may or may not even be aware of. Thirdly, patients who have prostate cancer, we always would mention, if you have any male children or brothers, any male relatives, you should consider having them get their PSA tested, and at some cases an earlier age, depending on the age of diagnosis of the person that you're speaking with. Well, genetic testing is one way in which we can tie recommendations to that specific person and their family members. And, with genetic testing, one thing that a lot of people failed to consider in the past was that prostate cancer patients could carry breast or ovarian cancer mutations or pancreatic cancer mutations. And those things would be passed down to female relatives and their daughters, So I feel like over the years, traditional teaching would be focused on prostate cancer patients, tell your sons, get tested for PSA testing. But we weren't really looking at the entire picture or the entire family. So now that we have genetic testing available for our patients, we can actually treat the whole family and not just focus on one disease, but focus on the entire sort of DNA spectrum of mutations which may exist.
So I could hear in our virtual audience, half of our virtual audience say, wait a minute, you're blowing my mind. I thought, like, I've got my blood test, I've got my biopsy, I've got the reports. Now it's really, am I doing surgery or radiation? And now you're telling me there are things that I could target, new kinds of therapies. I've got to look at my genetic history. I got to do yet another test. And we'll talk about what that other test involves. Sure. Hint, it's really not as bad as you think. It's just a blood draw, right?
It could even be a saliva test, actually.
Saliva, yeah. So, but I mean, why are you complicating this? What's going on? How's that going to help me?
Yeah. So I think that there's sort of two ways to look at why would you want to do a new test, because you've already been through so much. One way to look at it is to say, well, 10 years ago, this is what we did for people. And we've done a pretty darn good job of taking care of prostate cancer for decades now. With robotic surgery and these new innovative radiation treatments, HIFU and things like that. There are a variety of treatments that are novel, that have sort of improved upon the care that we previously gave to our patients. That's one way to look at it, and to be satisfied with where we are currently. But I think that it's important as doctors and as patients to sort of be forward thinking, right? And if we can find a better way to treat prostate cancer in the future, and if we can find targets in our patients now, which we could potentially use to help treat them in a smarter, more innovative way that gives them a better outcome, we need to find those targets. We need to find a way to fight those cancers better. And, with prostate cancer, chemotherapy drugs, immunotherapy, and these targeted sort of PARP inhibitor drugs I referred to earlier that sort of target patients that have DNA mutations, although they're currently used in patients who have cancer that's spread, the hope for me and for my patients would be that maybe we could envision a day in which we could treat those patients with targeted medical treatments and maybe not use surgery and radiation or other forms of prostate sort of cancer treatment that we use today to give them good outcomes. If we can improve upon the way that we manage patients in any way, I think that's well worth consideration.
Let's talk about the word target. It certainly brings to mind a gun and a distant circle with concentric circles getting smaller and smaller. Are you suggesting that we could identify where those cancer cells are and with precision destroy them, and thereby the golden chalice that we're after preserve my quality of life?
Yeah, so targeted treatments, what I'm referring to by that is that patients that have, let's say, a BRCA mutation or BRCA mutation, that's sort of probably the most common mutation you would find in a prostate cancer patient. There's a class of drugs available called PARP inhibitors that can provide better cancer survival outcomes for those patients than the currently available chemotherapy treatment options that exist for those patients once the cancer has spread. So it isn't as good as I wish they were. We're not seeing 100% outcomes in these patients where everybody who gets a targeted treatment for the appropriate mutation is beating the cancer 100% across the board. But what the studies are showing us is that those patients that have those mutations are having better outcomes, should we be able to find a target to sort of treat in particular.
And let's talk about the test. I mean, it's saliva you mentioned. Is it literally spit in a cup and pay the bill?
Yeah, so there's two ways to sort of do DNA germline mutation testing, which is what we're sort of talking about. One is either, just sort of saliva and do a test tube. The other one is a blood test. So there's two different opportunities to get these tests done.
How do you figure out which one to do?
So it depends on, you look at things such as family history, you look at the question you're trying to answer. And then there's a variety of different companies that have different ways in which they might do the testing. So there's a lot of different variables that go into deciding which one is possible. Most of my patients will simply do a blood test because it's readily available in our office. It's easy to process and get done right then, or in the future, should they decide that's what they want to do.
So you do the test, and a few days, 2 weeks? How long does it take for a result?
Usually it's going to be about a week or two for that result. So after I'll do a genetic test, I'll have the person follow up with me in the office and go over their results with them, or try to catch them over the phone if everything turns out okay.
Is there a reason to worry during that week or two waiting for the result? I mean, might I hear or learn something that's even worse that I already know that I have prostate cancer?
So I would not worry about the test, because if there is a mutation that we find, it's been present in you your entire life. There's nothing that just sort of changed from yesterday until today. It's just a matter of us discovering it with our testing that we've used. And in terms of will it change your prostate cancer, there are definitely a variety of studies suggesting that men who have prostate cancer DNA mutations, specifically BRCA2 mutations and things like that, can have a more aggressive type of prostate cancer. Yet, it takes lots and lots of research papers to sort of either verify this or dispute that sort of idea. And it seems like most people are thinking that the BRCA2 mutations in men who have prostate cancer might be a more aggressive type of prostate cancer than in those who do not have those mutations. But as I read the journals and try to keep up to date on research papers, the majority of the papers I read do suggest that, but every now and then you'll sort of see a counter argument to that. So I think that as the patients with the mutations get discovered and as the research sort of matures over the years, we'll be able to give more, probably more evidence-based guidelines as to what you do with patients that have these mutations with prostate cancer.
So a large number of people watching this probably have already, they're newly diagnosed and they're hoping for some wisdom, surgery, radiation, HIFU, whatever, or active surveillance. But they've already, from most people, probably a huge percentage, upwards of 85, 90, 95%, feel confident they've been diagnosed. And now it's a question of treatment decision-making. Should all of those patients return to their urologists and ask for a genetic test?
Yeah, I think that's a great question. I think that, genetic testing is important, and I think it's worth learning more about, but it's an individual decision. I think there are some patients who I'll speak to them about the pros and cons of genetic testing. The pros we've already discussed. Some of the cons might include things like, there's a GINA Act that sort of protects people who have pre-existing health conditions from not losing their health insurance. But some people might be at risk for losing things such as disability insurance, long-term care insurance, TRICARE insurance, if they have a genetic mutation. Now, as it stands currently, I don't have many patients who have said that this has led to them not being able to obtain those types of insurances. However, there is no current protection for people in America to be able to get those types of insurance if they do have a genetic mutation. Most of the time, if you fill out those applications, the question will simply come up, do you have any type of cancer? And that's going to be sort of the issue that might make it more difficult to obtain those types of insurances. But since we're not currently protected with our genetic testing results from those types of issues, that is one thing that's worth considering and worth mentioning. Secondly, I always talk to my patients about, we're looking for mutations that may be present in your children or your siblings or your parents. I think that it's important to sort of process that idea. Do you want to know that your children are at risk for something at a younger age than they may be even looking for it? Do we want to find mutations in your children if you do have it, in fact, present in yourself? So I don't think it's one of these tests that you should just reflexively ask for in everyone. I think it's something that people need to discuss and think about to make an educated decision for themselves. So I hope that answers your question.
Yeah, I mean, as in all things prostate cancer, there's no clear answer to anything, it seems.
Right.
Right.
That's right. Yeah. I mean, I think prostate cancer, any cancer, if you really want to have a good conversation about it, you're going to raise a lot more questions and you're going to have to seek those answers, And I think when you go to meet with your urologist or radiation oncologist or whichever doctor you're talking to, when you really get down to the difficult questions, you're going to find out that everybody's giving it their best, but sometimes the perfect answer may not be there, and it's an individual decision. Like you were referring to earlier, somebody might choose prostate radiation. They might choose robotic surgery. They might even choose open surgery or HIFU or all these variety types of treatments that exist for prostate cancer. Well, how does that patient come up with that answer of what they're going to choose, right? That's where that sort of discussion becomes important, and that person's specific preferences need to be taken into consideration.
Okay. Well, thank you for this, Dr. Rao. I'm sure it's not helpful, certainly thought-provoking. And I think everyone should, whether or not you follow through with genetic testing, it's certainly a question to ask your doctor about, and perhaps even spend more than 10 minutes Googling just to feel comfortable with it. This is the time to figure things out when there are new opportunities for better treatments, not just on the horizon in some metaphoric way, but in reality, things are waiting for approvals, and in a year or two, we'll have things to do that'll be good. Okay, thank you very much.
Thank you very much. I appreciate it.